subset of the population. And sample technique, usually sample technique is there are 4 to 5 randomized, non-randomized. So I will take one randomized sampling technique, stratified sample, systematic and convenience and cluster sampling. These are the types. On that one by one we can take it here. And classification of sampling is there are probability, non-probability. In probability, the systematic, stratified, cluster, sample, random sampling. And non-probability, convenience, snowball, judgment, and quota. These are the sampling methods. So coming to the with example for understanding your side, the random sampling usually what we do, the gathering the representative samples from a population where each member in population has equal chance of being selected. So for example, using random sampling generated to select students in a class complete two tasks. So in that picture, you have to take that being equal chance of being selected. That's called simple random sampling. Stratified, what we do, smaller groups of stratified within the sample are represented proportionally to the population. Finding out two of a favorite soap opera from different age categories of people in every group. So in that you have to take the proportional to the population. That is called stratified sampling. And in systematic sampling, every member in population is given a number. After first member is chosen at random, at remaining members are chosen from a given interval. So for example, a list of people with their first names in alphabetical order are numbered. Then fifth person is chosen randomly, followed by every subsequent eight person we need to take. So that's called systematic sampling. And in the non-random sampling, convenience sampling is used for easy to data collection. Volunteers usually collect the data, asking people given location and how long their commute and to work with the research. So that is called non-random sampling. That's called a convenience sampling. And capture, in that usually what we do, collecting a sample of data from one location at different points in a time, marketing individuals to the estimate of population size. So, for example, if you're taking the marked and released another sample from Uriclock was captured by 5 days later, and the number was marked, it is counted. Then, for example, when you collect the data from the one location at different points in a time, marking in individual to the estimate of population size, we need to think. So after that, third point, when while doing the methodology, you need to think the data collection method. There is a primary data or secondary data. In the primary data, we used to take the interviews, questionnaires, observations, and experiments. And secondary data, journals, databases, and reports. And tool and instruments is usually questionnaires, scales, checklist, lab tools, softwares. In that, we have to take the validity. In the validity, usually we need to think the accuracy of the measurements and reliability. And in that, after that, these are the very important. Already I told in the flowchart there is validity and reliability. We have to do it while doing the preparation of questionnaire. And after questionnaire, we have to give the professors to at least 5 professors to give the validity for the questionnaire. After that, you will get whatever the suggestions you need to implement and have to do it the validity of the questionnaire. And fifth, while doing the methodology, data analysis. When data analysis, there are lots of things. While important things are you have to do with the demographic, that is frequencies and descriptive statistics, mean, median, and standard deviation. While doing the interferential statistics, usually we do the chi-square test, t-test, ANOVA, and regression. And graphs for the post-graduation level, usually do the pie chart, histograms, scatter plots, including p-value and confidence intervals. These are the data analysis important factors, while at least you have to do it for the analysis purpose. So coming to the most important part is ethical consideration. In the ethical consideration, informed consent and confidentiality and no harm ethics and committee approval you have to take while doing the ethical consideration. And reporting and interpretation, while you are doing the present tables and graphs, discuss the limitation, what are the issues while doing the study, and prove evidence-based conclusions. So just see whatever the your questions you have at the point, that's called expected outcome, whatever you know. Just first you write, after that you make the list, what you will get the expected outcome. On that basis, you do the interpretation. So main important part, I'm coming to the qualitative research. When qualitative research you are doing, so you have to do the focus on qualitative research. While you are doing qualitative focuses on research, you need to explore to understand the meaning of behind the phenomenon, such as person, experiences, opinion on behaviors. On behaviors, you have to do it the data types. You are using in qualitative usually uses non-numerical data. What are the non-numerical data? That's called text, audio, or video, pictures. These are the non-numerical. How you take the sample size typically uses a small or focused samples. And what are the research roles when you are doing the qualitative research? Researchers is often more involved and their perspective acknowledgement as a part of research process. How you are going to process, you have to do the inductive process where patterns and hypotheses are developed from observations. You need to see their behaviors, their ideas. On that basis only it will suitable for exploratory studies where the problem is not clear defined. So common methods, while you are doing the common methods, you have to think these 4 points. In-depth interviews, focus group, ethnography. In in-depth interviews, one conversation to gather the rich and detailed informations. So in next slide, I given the main one by one in-depth interviews and all about the in-detail information. So just for understanding, I have given this slide. So in focus group, you have to understand the small group discussion to explore a topic and observe the interactions. And ethnography, what we do in the researcher usually the participant environment and observe them in a natural settings. So whatever in beside going through we have, so we need to that catch up and we need to write in the as it is that observe them in their natural settings. And participant observation, the researcher actively participates in the group behind studies while also observing them. So these are the very much important when whatever you are going through actively participate in being studies, we have to observe them and you have to note take. And after the strength, what we have to do, it provides deep and understanding, captures context and can generate new ideas or theories. In that there is a strength of this study is you will get the new ideas of theories of the qualitative research. And limitation, data analysis can be time consuming and subjective, and findings may not be generalizable to large population. So here, when you're taking the more than 1 lakh, 2 lakh sample size, that is very difficult to take down. And after that, while how you are doing to be done the analysis and all, I will tell you in the analysis part. So these are the limitations. So this is the qualitative and quantitative, two types of qualitative and quantitative. So So coming to the qualitative based on the collection and analysis non-numerical data collections, in that usually we have to take the qualitative informations. For example, non-numerical means text, audio, and video. These are the already we have discussed in the starting slides. In that, how to do, then how to explain the non-numerical the information. For example, you are taking the stories, experiences, or observations, or feelings. You need not to number. These are the not numbers. These are the non-numerical datas. So, for example, if I ask you, how do you feel about the online classes? So, your answer might be, I feel stressed because of connectivity issues. So, these are the qualitative data. So, what are the numerical data? For example, interview, open-ended questions, observations, focus group, and after that, diaries, photos, recordings. These are the qualitative. So, non-numerical data, you have to understand these are the qualitative points. So these are the types of studies. So today I'm covering only qualitative. These are the quantitative already in the first slide also I described. So I'm taking only qualitative. So these are the qualitative studies in that empirical and theories. Empirical theories that comes under the qualitative and quantitative. Only I'm taking qualitative. Qualitatives there are already I've discussed in the previous slide. Case studies, ethnogroup studies, phenomenal studies. So in that these three are very important in the qualitative. So quantitative versus qualitative. So in the qualitative, usually we take the importance, what are the important subjectives, generate the ideas, theories, and descriptive. What you are going to be search of meaning and understandings, how you are going to be done. So these are the very much important while you are doing the qualitative research. So for example, qualitative research is a science because it follows the systematic, right? When you have to do it is science and art both. So yeah. So in the qualitative research, in the subjective, extremely sorry. So in the qualitative research, we have to take the subjective, general ideas and theories, and descriptive and search meanings and understandings. This we have to think the whatever the subjects you are taking, you need to take care of that points. points of the ethics. And while you are doing this, you have to think about the important factors while you are doing the in-detective explanatory and in-detective non-predictive answers, and uh, while you are doing the researchers behind the stories. Sorry, my slides are moving.
Yeah, is movie.
Yes, sir.
Hello, my
Yeah.
slides are moving.
Yes, your
Yeah, okay,
slides.
sorry. I think network issue. So in that qualitative research, usually we have to take the subjective general ideas and theories and descriptive and search meanings and understandings. In that, what we have to do it in that qualitative research helps us understanding human experiences. So for example, in the subjective, usually you have to take example I will give. Two pregnant women using teleconsultation may feel differently. One may feel safe and another is comfortable, and in that another may feel disconnected. So what you have to feel that, have you ever felt differently about the same situation compared to your friend? That's called subjective. And coming to the generative and ideas theories, that for example through interviews you might discover something new ideas. What new ideas? Women may prefer teleconsultation for privacy but struggle with technical issue. So in that sense, you can qualitative quantitative testing are reduce the ideas and build the first ideas. So for example, in that you build the ideas first. In that you can do it the generated ideas and theoretic. And descriptive ideas, what you say, the instead of reporting 60% women were satisfied. What you say, women felt satisfied because doctors spend more time listening and, for example, explained everything clearly. So what are the point you have to understand in descriptive? In that, show a text expect from real interview. So maybe you have to take the real point of the view. And searching the meaning and understanding, how the main goal is understanding the behind meaning people experience. For example, what does it mean to them? Why to feel them that way? For example, I can give you as per my experience. You can see the woman may have say, I prefer telecommunication because I prefer safer from infection, or weak network makes me anxiety or stressful. This gives meaning. So not just data, but maybe search meaning and understanding. That's reason this is the qualitative research. So coming detective versus in detective. So here I'll take only the qualitative point. The qualitative in detective point, when you are taking about this, so you have to think about confirmatory and detective. What are the research question or hypothesis comes in your mind first? Test if an existing theory is true. Move from general to specific. For example, exercise reduce anxiety. So what is your hypothesis? How you are taking walking 30 minutes daily reduces anxiety among pregnant women. Then collect data, it confirm or reject it. So what is detective means, you already have an idea and you want to test it. So that's called detective. And in detective means what? For example, explanatory and no preconceived assumption. For example, pattern emerge from the collection data or move from specific to general. So if I want to give the example, you interviews, for example, 20 pregnant women with no hypothesis. While analyzing the data, you discover theory trust doctors who communicate well, they fear complications. Or the third, you can think about telecommunication helps reduce the travel stress. So these are the important patterns helps you build a new concepts of theory. So what you learn from this in detective, you explore first, observe the patterns, then build understanding. That is called uh, in detective. So coming to the again detective, the research part is what you think. Detective starts from the head, and in detective start from the ground. Ground level it will start, and detective part will start from the head. Hope it's clear this slide. So what is the role of research? Research, what will do it? The research means what we think, what questions to ask, what methods to use, how to interpret the data, how to ensure the rigorous or ethics. You need to think all researcher become an instruments you do it while doing the role of researcher. So measurements. So while you are doing measurements, you use observations data. or conservation data to long descriptive text using people's own and words and dialogues. Because when you are doing the measurements, you need to think like how much your data taking, you have to write down in the scripts and while doing the qualitative research. So while doing the qualitative research and build the stories. So science versus arts. So while you are doing the qualitative research approach, you have to takes a lot of practice while you are doing the qualitative research. And as well as the what are the like what is the science how you are doing too, then the quality research both science and art are both are same because it applicable to both in qualitative research. In quality research, usually we do the systematic steps, but is also an art because it requires skills, interpretations and sensitivities. So this immediate, if you understand the science part, it follows a methodological framework, and after that you have to do the coding, theming and analysis. And if I want, science gives quality research is structure and reliability. In that, usually science what we gives it that it gives the structure and reliability, and art part usually it gives the interpretations, the behind the words, and must be deeply and sensitively. And after that you have to understand the emotions, context and behaviors in the science part. So it takes a lot of time and it takes a lot of practice to do well. And while you are doing, you have to think about pick their emotions, tones, and hiding their meanings and context. While you are doing, while you are presenting, you have to write each point in qualitative. For example, if you are interviewing mothers about breastfeeding challenges, so you have to think about their protocol. After that, record data, how you are doing the course systematically. And art, you pick a emotions, tone, and hidden meanings and context. So in that last point for important, this is the it takes practice to do qualitative research well. When you are doing, not because it's difficult, because you must balance logic and creativity. So while doing qualitative is very much need patience and everything to doing this research. So now nature of qualitative research. So while doing the nature of qualitative research, you have to think the qualitative research involves, already I informed in the, what people think and how they feel. It involves the feeling and impressions rather than the numbers. After that, the already I told the information is subjective. And quality research involves interpretative and after that naturalistic approaches to the subject matter, how you are going to be done, how it looks, their feelings you need to see, how their emotions, and study people and their thoughts in their natural settings, attempt to interpret phenomena, how we are going to be like think their natural settings, how they are sitting, what they are suffering, and you have to catch up their emotions. And after that their it needs to be see their feelings. So in the quality research output, you have to think the new ideas and description of previous unexplained situation or behaviors, and narrative about experience, what they felt previously, how you are going to be done, and after that compare the events and behaviors, and you need to think about the new ideas in depth and understanding. So examples of qualitative studies, most of them you can see the examples behaviors of individuals with HIV living in South India. So seeking information about HIV/AIDS, qualitative study of health literacy among people living with HIV and AIDS, qualitative study of obstacles of condoms used in HIV prevention, trial in sub-Saharan Africa. So qualitative research of barriers to use of implementing the CAD prevention in primary care. These are the examples while doing the quality study. These are the titles while you are doing the studies to just understand. And so coming to the one more slides of the examples, after that spiritual issues and needs, perspective from the patients with advanced cancer and non-malignant disease, qualitative research, or colorectal cancer screening in older men and women. In that you have to think about qualitative research findings. This means you have to think about what they're experiencing. Most of the I give examples of HIV and AIDS because in that they feel mentally they have lots of issues while they are suffering from disease, from like in the cancer also. Most of the studies done in cancer or HIV, AIDS, these are the only because they will understand the what are the importance in that feelings or emotions while writing scripts and all. You have to understand about in the qualitative research. Study design. So already I told you the in the flow chart. So these are the three. You have to understand the phenomenology, ethnography, and grounded theory. So phenomenology means structure of experience on consciousness. Study how people describe things and experience them. Example, you can see the back pain. In randomized control trials, drug compare effectiveness of drug A and B. So you need to think about that phenomenal study examples, effect back pain on patient's relationship with other. So you have to compare and you need to take down in the script and write strain in marriage, effect on children's, what are the family histories you need to think. That's called phenomenology. So ethnography is definition of ethnography is social interaction, behaviors, and perception that other within group and teams, organizations or communities or areas. These are the things where happens in social interaction. That time you have to understand their issues and problems of the ethnography, and that observation details with everyday life as a natural unfold with real world. So what are the issues ongoing and real face? That time you have to understand the what are the researchers examines the patterns of behavior, customs, way of life, and describe the culture and way of life from the people point of view. See, whenever you do the research and all, is as per my opinion, what are the challenges and issues, hurdles you face, you need to convert as an opportunity. That time only you will understand the lots of issues. What when you are doing the reading the theoretical and while you are doing the research in practical, there are lots of differences. So you convert all whatever in life you are as a researcher, you are faculty or you are a MP student, you just focus on the problem solving, how you will be the solve the mortality and morbidity. As a public health specialist, you have to solve this mortality morbidity issue in the whole worldwide. If you are staying in India, you have to solve the issues on that. So is my opinion always whatever the challenges issues comes, just convert into opportunity, then automatically it will solve your issues and all. So take it positively, because whole and soul you have to do it. The if you are a researcher, hardcore researcher, you want to be a famous and you want to do the lots of publications and recognition, automatically get. I get the from nature or BMJ, BMC as a reviewer and as a editor board member request. So how I'll get, because I started from the grounded crisp and I just learn everything in each point and understanding what are the points, how to do it. Don't grasp up or don't by heart. Just do it from heart. Automatically everything you will get. So in order to achieve this, the researcher need to live with the participant in the daily lives of those they are studying, and themselves they have to culture situation understanding the study. For example, whatever you, for example, you have taken the HIV/AIDS topic, so you have to see what they are suffering, what how they are feeling, and how what are their anxiety. You have to first you have to feel that, and after that focus on everyday their life, people, natural settings. So observe and do it interview, then automatically you'll understand their issues and you can write in the your script. So help healthcare professional develop the culture awareness and sensitive, enhance the provision of quality care for people from all cultures. So if I want to tell the examples, cultural rules about contact between male and females may contribute to reduce of women from Asian subgroup to take up cervical cancers. So when you do this, you have to think about their sensitivity, awareness, how you are going to do, quality of care from people. So grounded theory. In the grounded theory, it does not rely upon the prior assumption. Theory is theory is grounded in data. Researchers detect patterns in observations and then create working hypotheses that direct the progression of inquiry. For example, what happening when a patient complain being in pain, but the nurse doesn't believe for her. So in that situation, you need to think the ground level. You have to think, and after that, study of school nurses experience dealing boys who have eating disorders. So this is the research paper. Just you can see, you can read the title, Patients Pursued the Usefulness of Online Electrical Medical Records, the empowering the grounded theory in the development of information and the communication technology for the use patients living with chronic illness. In that, what they taken the objective, patient use of online electronic medical records holds the potential to improve the healthcare outcomes. The purpose of the study is to discover the how patients living with chronic inflammatory bowel disease value internet-based patient access to electronic patient records. So in that, what they are doing the grounded theory in the development of information. So methods of collecting quality data. These are the very much important now because while you are doing the collecting data, what are the important factors? How you are going to be collect the data? How you are going to be like step by steps? How you are like to see the qualitative data collect and importance of the data to carry out it. The interviews, while you are doing the interviews, highly structured, semi structured or unstructured things you have to take. After that, the structures interview asking each respondent same questions in the same day. For example, do you think the health services in the area are excellent? Like you have to write average or poor. Or differently, if you want to one more example, is your health excellent, good, fair, poor? So while you are doing the interview, you have to give them coding. It's called coding. So you have to give the three options uh, while doing the study. So semi-structured interview. So like for example, open-ended. Open-ended questions means provide opportunity to discuss the topic in more details. So for example, I would like to hear your thoughts on whether changes in government policy have changed the work of the doctor in general practice. So these are the open-ended questions. There is no options. Directly you are asking the question. That's called open-ended. So unstructured interview like depth or in-depth interviews. So aim to discuss a limited number of topics. For example, can you tell me about your own health experience? So that time they will tell their opinion and answers. These are the strength limitations while doing the interview researchers. So face-to-face setting allows you to probe and follow up and can collect the data on behavior events you cannot observe. And interviews produce an enormous amount of data. Participants can stray off courses. After that, participants may be the hesitate to talk. So while they are doing these are the strength and limitations in the interview section. So main methods in that you have to think about the individual, focus group, and observations. So here individual while you are doing the individual qualitative research, going deep into identify the source and resolution of problems, gaining specific information about individuals' experience and knowledge and beliefs. And second thing, while you are doing the focus group, collect the information from the group of people rather from the individuals. Used when group interaction among participants has potential from greater insights. So while you are doing the focus group, you have to take the 6 to 10 people, smaller limits of collective information. More may makes difficult or interaction. So you have to take the 6 to 10 people, and on that basis, or you can do it the focus group. So this is the example of the focus group file you are doing. One is note taker, another is moderator need to sit, and all 6 participants. In that you have to keep the tap records. So easy to understand while you are doing. Just make the don't do by heart while you are doing research and all. Just make them understand how to do the qualitative research while you are doing. The sketch them, you do it. I told in my first slide when while you are doing the study, you have to keep the checklist. Automatically it will goes everything smoothly, otherwise it will confusion. I always ask my students while they are doing MD or a PhD, so what is your title, what is objective? अरे सर रुको मैं देख के बताता हूँ. अरे no, you have to understand what you are doing. So I'm not asking as it is, the give me the title as it is. You have to understand what you are going to done, what is your expected outcome. So just what whenever you do research, just make the first list and make it easy, because while in the in between while you are doing PhD, you don't know where is your copy of introduction. You have to make the slides, we have to take the pen drive, everything and kept in the uh, uh, hard disk, and everything is important. At the end, if something is gone, then there's very much difficult to keep all the data together. So while doing this is the in the focus group, 90 minutes must be completed need to take. They introduce the participants. First, you have to introduce all participants, serve the refreshments, and conduct the discussions. Okay. So I kept the very simple slides to understand you all, not the big slides and all. Just to understand when you want to be hardcore researcher, to do it main things while you are doing, to keep 90 minutes, introduce the participant, serve the refreshments and conduct the discussion. While you are doing the content discussion, respond the encouragement to interact with the one to another and summarize what was said, and as feedback and participant you need to take it. And observations. What is the observations? Definition of observation means what? Not all data collection requires direct interaction with the people. Used when other people means, or when other means limit or difficult to validate. For example, participant may not guarantee to answer what they actually to do. Maybe they have anxiety, they fear of the stage during talk. So techniques collecting data while writing the description, video recording and photographs, you need to keep it and involves the systematic and detailed observation of behavior or talk tends to be naturalistic. So already I told in the observation issue it looks is to be natural and people are studies with minimal interference by the researcher. So coming to the quality research data and analysis, how are you going to collect the data and what will be the going to be done? So what quality research you are doing? The first while you are doing, you need to keep these things importantly. Field notes, interview and focus group transcripts, documentary material, research own records, photographs, and audio video tabs recording to face interview. In that data and storage, how we are going to be do it the data, describe the data from interviews, observational notes, and you can keep the short notes and all, and word processing documents, and import the data analysis in one program. After that, develop themes or events, and how we are going to be analyzed using the qualitative data computer program. So in that, how we are going to be collect the data process. In the usually when data analysis trained to be ongoing, then you should be being just after and first data collection. A relaxed process, move back and forth between data collection and data analysis. First, while you are doing the taking notes, photographs, videos, you keep it first. After that, while doing, you need to write all the points. While you are doing, for example, in the qualitative data, while you are doing the you are the interview and again, then you may the helps you understand the feel of what people are saying. So you have to understand the students talk about fear and take the pressures. So these are the data many times you are returning. Then you have to think about coding means highlighting important points and giving them small tables. For example, fear or failure or sleep problems. And when you're talking about the coding, you have to give the small type of coding, like if you, they have fear the problem with the ongoing exams, so you have to write fear only, or problem with the exam, so you have to give the coding and locate the segments and code them. These are the computer programs for quality research. I'm not going in depth because these are the packages are available in the internet also. You can download it. And for this, we can keep one more lecture with statistician. He will understand how to do it, entering the data, how to give the codings and all. These are the only I given the most important and basic points while doing the qualitative research. So how to do, usually you need to collect from the data in the Excel sheet or the Word document, and after that you have to put in this software, and after that you have to update like same like a SPSS. After that you will get the data and it will the coding wise whatever you have written in the codes. So this is my number. We can because in 1 hour taking all the research points is very difficult. I kept the short and script to understand the what are the research and problems. So you can message me. I'll try to teach you what are the points, how to give the importance on publications, and what is the chances to how to write the papers and all. So always I feel in life, though no one forces us to do anything, it always our choice. Okay. Thank you so much. Thank you. I tried my best to teach you all. So is there any questions you can ask in chat box?
Thanks a lot, sir. It was a very informative session. Thanks a lot.
Thank you. Thank you.
If you can, everyone, participants, you're requested to ask your queries in the chat box. We'll take one by one. Adesh Patel is asking, is 90 minutes interview mandatory?
Yeah, Adesh, thank you for the questions. Not necessary, but as per the guidelines and all, if you are a PhD candidate, at least it's important 90 minutes to take the data more and crisp when you are writing. But it's fine if you are doing the MPH, it's 60 minutes also fine, 1 hour data. But as per the guidelines, it's 90 minutes written. Thank you.
Any other question, participants?
Is there any free software for the coding the interview? See, as such, there is a no free coding softwares, but we have available the trial package, but that's for only 1 month. So better you can contact your library if you are working at if you are doing PG or MD or PhD. So in library there are lots of softwares available. Just to request them, they can provide you. So it was good. Okay, sorry, I haven't talked in Hindi. Okay, so next batch I can take in Hindi also. Thank you. Next question. Good afternoon, sir. Please.
Someone has asked, can you please see an example of ethnography methodology?
Sorry, what they ask?
Can you please see an example for ethnography methodology?
Ethnography. Okay. So already I informed and teach you here only. So see, here in this slide, what is the ethnography? I told you all. The social interaction, behaviors. You need to think about your behavior in the group, teams or organization or in any community area, in that society. You have to think about the researcher examines patterns of behavior. So how you are doing, the natural unfold. You have to talk about real words. So what are the ethnography? आजू बाजू जो भी चल रहा है, you have to think cultural wise, and as it is you have to write in the your स्क्रिप्ट सो ऑटोमेटिकली पॉइंट ऑफ व्यू आपको लोगों को देखना है सो दैट इज कॉल्ड इथनोग्राफी सो होप आई आंसर्ड योर क्वेश्चन
So, where can I learn more about theories used in qualitative research for analysis? Theories used in qualitative research for analysis. Where can I learn?
in qualitative research everywhere is theory only there is non-numerical data so you need to use in everywhere theoretical.
And how long should in-depth interview last? And is there any limits in the questions?
Yeah, in 90 minutes whatever you cover you can there is no as bond of the question but at least you have to cover 90 minutes.
Neha Patyal has asked how to validate the qualitative questionnaire or tool.
Okay, qualitative questionnaire you have to make first you have to adapt somewhere from the questionnaire of the qualitative what your topping going to be done. After that you have to make 5 copies of the your questionnaire and you have to area of interest professors and they will do validate accordingly and whatever they give the suggestion comments you have to solve it and after that you need to submit one checklist of the validation. So after that that's your validated questionnaire of the qualitative research.
Chinmay Borkar requesting to take lecture on how to prepare for publication. All right.
Sure. Yeah, we'll do it in the future
Yeah,
lecture.
yeah,
I will
sure.
collaborate with the statistical part with the statistician, so it's easy for understanding because coding and whatever they have their area of interest. So we'll do it that also. I'll discuss with the Salman, so we'll do it in the future also.
Sources, some online courses or books.
Sure. I have some notes and all. Please contact me personally. If I'm busy, I will give the answer on WhatsApp. Just message me, and we can discuss. I will give whatever you data and all. I have international levels from John Hopkins University, WHO. The easy to understand. I have the manuals also, so that I will provide to you all.
Salman, can you see any other question?
Last question. Explain about ethical consideration. Okay. Ethical is very much important while you are doing the qualitative research. Ethics is at most very much important, and researchers and usual people ignore that part. If something happen while doing the research, that time there are ethical parts you ignore, and that time if happens, then you need to suffer. That's called you need to take the ethical. If you're doing the experimental studies, intervention studies, if something happen, you are giving them drug and all, that time it will issue. In qualitative there is not issue, but you have to take the ethical, that is mandatory. Yeah, refreshment during FGD session is essential. Yeah, it's not essential, but while you are doing research, it is mandatory to give the refreshments and all, because you are doing the focus group and you are giving them claim and the what you call anxiety उनको शांति से कर रहे हो, तो दे कंफर्टेबल से आंसर बता पाएंगे. तुम लोग डायरेक्टली जस्ट क्वेश्चन आंसर कर रहे हैं, डरेंगे. क्वालिटी रिसर्च फुल्ली नॉन रिमेडिकल है, तो जो भी वो बताएंगे तो उनको एंजाइटी नहीं रहना चाहिए, डिफिकल्टी नहीं रहना चाहिए. उसके कारण रिफ्रेशमेंट देके उनको थोड़ा सा नॉर्मल कर सकते हैं. Yeah, DVL also good tool for analysis, but when you are doing comparing them, compared to there are many, but you can use also, but just try, because there are lots of the softwares while doing the analysis. But better you can whatever you use, all are the valid softwares only.
I guess there are no more questions now. Thank you so much, sir.
Case stories consider under quality too. Yes, case stories also can
Yes.
take it, but should be non-numerical data, not the case studies. Yeah. Okay. Thank you. Thanks to all. Thanks to all the
Thank
senior
you.
faculty,
Thank you
higher
so
authority to
much,
giving me
sir.
the opportunity. Really, thank you.
Thank you, sir. Thank you, sir.
Thank you, Dr. Sudhakar. Thank you, Salman. Thank you, all
Thank
registers and higher authorities to giving me an opportunity. Really, I enjoyed a lot. Thank you. Thank
thank
you.
you, sir.
For me, it's a revision. It's really enjoyed.
Yeah, for a revision for us too.
Yeah. Thank you so much.
It was a very informative session, and I hope everyone has learned something valuable today. Now, I would like Salman to say a closing note.
Okay, so we study quality research, bring us the closer to the pupils. It's allowed to us to design the better interventions, policies, and the solution grounded in real human expertise. So I extended my sincere thank you to all participants for the attending this webinar. Your engagement made this session meaningful. We are looking to continue interest in our future programs. We are going to be continued. Thank you for all of.
Salman, 1 minute. I have one more query. Please give me feedbacks if anything to improve the slides, improve the easy to understand it, because I kept very crisp and very small slides to understand. There is not kept big theoretical points. Just per I given my opinions and ideas. So give me the suggestions so in the future it's easy to me to improve, because it's two-way learning.
Yeah.
Whatever I also learn and this. Okay. Thank you so much to all.
Okay, we share the feedback form in the chat. You can check and you can fill the forms. And I request you to, Amin sir, please give me the closing remarks.
थैंक यू सलमान लेकिन मुझे लगता है कि क्लोजिंग रिमार्क्स की अब जरूरत है क्या ऑलरेडी यू हैव डन अ वंडरफुल जॉब
Thank you, sir.
चलिए
Thank you, sir.
आप जैसे कह रहे हैं on behalf of the Maulana Azad University and especially on the basis of the Department of the Public Health, I sincerely extend my thanks to all the participants because it's a very hectic in working hours. You spare 1 hour to attend this webinar, and especially when there is a topic of the research methodology because people normally in India especially are not very intent to have or to do a very qualitative research, and I hope a research is a basis of any innovation, any new things, any contribution to the community which we can do, no matter in which field we are. And without quality, that research is all of no use. So I really appreciate and a very deep gratitude for the Abhishek, Dr. Abhishek, for sharing their enriched session, and especially very practically and very uh, deeply you have tried to touch the data collection, sampling, and the thematic analysis. Greatly, I appreciate the way you have tried to wrap up the complete chapter in a very small span of time. मतलब जैसे कहते हैं ना गागर में सागर भरना. So you have tried to touch the each and every vertical of the research, especially which is very much needed for the qualitative analysis and everything. So really thankful for your sharing your practical approach, and hope this sharing and this webinar will be a next and a very uh, life turning point. Those who really want to do something in a research. I also try extend my appreciation to the Department of Public Health, all the staff, all the technical team member, and everyone those who have done their tireless effort behind the curtain to make this webinar successful. And thank you, all of you, for conducting this successful webinar. And especially again, I would like to thanks to the participant, those who have actively involved in the webinar and flag a very innovative and a very concrete questions. Thank you once again for a wonderful and a very interactive session. Thank you, all of you.
Thank you
Thank you,
so
sir.
much,
Thank
sir.
you. It means a
Thank you,
lot.
sir. It
And I
means a
agree to
lot.
your points.
Thank you, sir. It means a lot coming from you.
We can
Thank you.
conclude this session now. Thank you.
Yeah. Thanks a lot, Dr. Abhishek. Thank you.
Yeah, thank you. Thank you. Thanks to all.
Thank you.
Thank you.